extension. So again, you're working on concave on convex, right? So of the tip femoral joint, and I'll show you the opposite. You're going to work from the femur. So with this, you want to position of the knee open packed is about 25 degrees roughly, 25 to 30, depending on the source. So if you don't have, you could use like a little bolster. If you don't have that, you don't have this. So you could just use that to make, give or take, 25 degrees. If you really want to, measure it, you could do so. So sit here. I'll do first what I told you guys before is get them comfortable, see how tender or painful they are. I mean, obviously you're gonna work in your grading. So 1 to 2 is for pain, 3 to 4 is for range of motion increase, right? And stop me in the middle if anyone's confused with anything I talk about. So with that, I could leave in this position. Again, my body mechanics. I'll just crouch down. I could use a stool too, but in this case, I'll just use my body. I'll squat, and I'll do a little slight distraction at the knee. And my body, instead of me using my hands, I'll use my body to pull back. And you can do a little oscillation if you want, or just hold the distraction for about 20 to 30 seconds. What would you say, Dr. Heinlein? Any particular time you have that you?
No, usual spring test, if you just check and joint assessment, 10 seconds.
Okay. Yeah, 10 to 20 to 30 seconds,
Yeah.
whatever. So then from there, I have to do a little distraction once or twice. And I'm going to tell them what I'm going to do. So in this case, say, well, just because I want you to see the motion, say I want to do a grade 3. So I'm going to stabilize the femur, and I'm going to cup the tibia. And from here, to improve extension, I'm going to, again, this is kind of indirectly moving. Everything's coming from here. Okay, so then from here, I'm just going to do a grade 3. So it's slow, right? Slow oscillation from going into the joint. So I'm going to end range, and then backing to mid range, and then back and forth. And again, I'm checking in because sometimes the pressure from my fingers might be a little tender on the patient, so I might want to re-grip. You okay with this?
Yeah.
Always check in. Obviously, sure you put a pillow for her.
I don't know.
Remember
Just because I want to be able to
patient
look.
comfort.
No, I just want to be able to look at you.
And then a good 30 seconds, I would say. I always go by 30 seconds is a good point. Back and forth slow. Take it to end range and then back off. Okay, and that's concave on convex. If I want to do the other way, I stabilize the tibia and fibula. And now since this is convex on concave, right, it's going to go in the opposite direction. So with that, I'm going to push down. As I'm stabilizing here, I'm pushing, this is the active arm, and I'm doing this. So same thing, just understand the application, right, being applied. Convex, concave, concave on convex. And I'm using, so I feel like my chest tightening, so no, that's what you want to do. You don't want to come from the shoulder. Stay tight, bend your knees, good form. Come through here, okay? Just like that. So that's for the extension. Flexion is just the other way. So if you want to work the tibia on the femur, you're going to go into the direction of flexion. So down, posterior. So anterior glide, this is going to be now posterior. So stabilize here, and then just the opposite direction. So say with grade 3, say. And then vice versa. So that's posterior glide, so then the femur is going to be the opposite direction. Stabilize here, hold it here, and come up. Does it feel okay?
Mm-hmm.
And then grade 4, oscillate and hold. Just like that. Obviously you have a high-low, so you set it to yourself. Not if it was a high table and there's no adjustment, stool. Make sure you have the right proper body mechanics. Other thing, since the patella is here, now this is open pack for the knee, patella, flat. Okay? So if you don't mind, I'll use a stool instead of me leaning over. I could do that, but might as well keep myself comfortable. If you could slide towards me a little bit. So just relax her, and then there's no grading with the patella. It's just depending on how much apprehension, how sensitive she is. Now there's medial, lateral glide. There's inferior angle glide, lateral, so back and forth like this, tipping. There's also superior, posterior, and there's also, it's not on the sheet, but also to lift off the patella. You could just try to lift it off like that for if there's any type of chondromalacia or any compression into the trochlea. I'll lift it up like this. And there's also with the Institutional Physical Arts, a plunger that they have, where you could plunge the knee and lift up. It's pretty funny. You hear the little.
That's good sound effect.
Yeah, it's so funny. But it works really well, and you can feel like a lot of the time, not all the time, but a big difference with the patient with the knee when you apply that. When it comes to now knee extension, because the pull is upright, so to improve, because you have to also look at not just the knee joint itself. It's also maybe the patella that's bogged down and not moving right. So a superior glide is going to help with extension, and an inferior is going to help with as it moves the patella down, right? Inferior glide is going to be for knee flexion. Okay. So in this case, I'm going to stabilize the femur. Just do, or you could do back and forth too. To go both, but we'll just do one at a time. So just this way. There's no grading, like I said, for this. Just modifying your pressure or the glide according to how the patient feels. And I like the patient lying back all the way if they can. Sitting upright, they're tightening the quad. Remember, I think I told you guys that, if they're sitting in an upright position, everything's not relaxed to the full extent. I like them lying all the way down, okay? And then the same thing, a medial glide with the thumb pad pressure, thumb to thumb. Lateral.
This one's great. This one's not graded. Right?
Not graded, just going back and forth. Like I said, you could back and forth do this, but I'd rather you go one at a time, okay? And then the lift off. I know it's not on the sheet, but just trying to get the patella to lift off a little bit. And once you get a good grip, you just hold that. So you're just distracting it. So you're helping all directions pretty much. Any distractions to help with all directions. Okay, that's the knee.
Medial lateral tilts.
Medial lateral tilt, that was it. So back and forth, medial tilt, lateral tilt. Just like that. Okay? Sometimes the reason why you do this too is because the IT band hooks on a little bit to the patella, so it tightens up that area, so you might have to do like a medial glide just to release it. A lot of this stuff actually happens mostly out on the lateral side, where the patella is manipulated. And that's where you do a lot of the work, is about the retinaculum at the knee, okay? It's going a little more advanced when it comes to the knee. What you can do too is mobilization with movement. So once you do the whole relax and distracting, once you distract, what you could do next is show you a few things. So I put my forearm underneath to create space at the femoral tib joint and work into the desired range I want. Okay? Just like this. Make it easier. Weight shift my body as I crack my head. More hips. Okay, so that's one way. The other way now think about the biomechanics and the anatomy of the tibia on the femur. When you extend the knee, you externally rotate the foot. So what you can do too, in this case, is push down. As they push down into the towel, push down for me please. I could externally rotate, so help the mechanics, the joint mechanics out too. So I immediately rotate the femur as I externally rotate the tibia. So do it again, push down, and I rotate. So I'm helping along with that full hyperextension. Or if I really want to get rid of the towel in this case, because I'm not getting into true hyperextension, now push down. Now I'm really working the end range of extension. Make sense? Same for the other way. So what I could do is I could help with flexion. So then you're going to internally rotate the tibia as the femur goes the opposite direction, right? Externally rotation in this case. So then I'm going to help promote that. Now, heel slide, slide up, okay, and down, slide up, slide up. I don't want to go too much in depth. I just want to show you different ways you can help promote knee flexion extension. Patella, mobilizational movement, and just standard Maitland glides with the grades. Okay?
What was the one that you just did? Sorry.
I did a mobilization movement, but helping out the mechanics of the joint mechanics of
So that was
loco-
more to unlock than like to.
You get more hyperextension. So
That
once
was-
once she pushes down, I'm externally rotating the tibia.
Right.
Screw home mechanism.
Yeah,
the
the
other
screw
one's
home, and I'm
unlock.
also internally rotating the femur,
Okay.
and the other way, vice versa. So then I'm going to externally rotate the femur, internally rotate the tibia to promote more knee flexion, and I want to take it maybe all the way in to see.
Thank you.
Okay? And
So
she
you
has
bring
no
them all the
pain.
way in.
Yeah, you could. I just wanted to show you, but then to really promote more of that flexion, I want to bring her all the way in the most likely pain-free to work on that. Okay? All right, let's practice that. Any questions?